Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Mrs. Hamilton, please have a seat. I understand you'd like to discuss your son, Aiden.
Yes, thank you. Aiden's 8, and I thought it would be good to discuss my concerns without him present first.
Completely understood. Can you tell me what's been going on?
It's his eating habits, or rather his refusal to eat. He's become incredibly picky, only eating a handful of foods and refusing anything else. It's not just about taste. He seems genuinely afraid of certain foods.
Has this been an ongoing issue, or is it a recent development?
It started around a year ago. At first, we thought it was just a phase, but it's been getting progressively worse. We tried to reason with him, make mealtimes fun, but nothing seems to work.
Are there other concerns apart from his eating habits?
Well, it's not just the refusal to eat. He's become quite withdrawn, especially in social situations. He used to enjoy going to friends' birthday parties, but now he avoids them. He says the noise and crowds overwhelm him.
What interventions have you tried so far?
We've attempted to introduce new foods slowly, created a reward system for trying something new, and even consulted with a nutritionist. We also enrolled him in a social skills group, hoping it would help with his interactions. It's been a mixed bag. He enjoys the group, but hasn't shown significant improvement in his willingness to attend social events.
Can you share a bit more about Aiden's overall demeanor and any changes you've observed?
Sure, he's a bright boy, loves reading and puzzles, but he's become more and more rigid about routines. If something changes, even slightly, it throws him off. He also has a heightened sensitivity to lights and sounds. For example, he'll complain that the light in a room is too bright, even when it seems normal to everyone else.
Based on what you've shared, it sounds like he's experiencing sensory sensitivities. Would that resonate with your observations?
Yes, that seems accurate. I didn't know how to label it, but he does seem hypersensitive to his surroundings.
What are your primary concerns moving forward?
I've been reading up on sensory processing disorders, and I'm wondering if that might be the root of his issues. I'm concerned about his social development and ensuring he gets the right nutrients. I want to know how we can support him better, and if any interventions or therapies might help.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Thompson. I see from your records that you've been experiencing some health issues lately. Could you tell me a little about your symptoms?
Yes, doctor. Well, I've noticed I've lost a bit of weight recently, even though I've not been on a diet or anything. And my appetite's gone down. It's like I get full even when I've barely started eating. I sometimes feel like food just isn't going down right, like I'm choking or something.
I see. That must be tough for you. Have you noticed any changes in your bowel movements?
Yeah, I think so. I've noticed that I often need to rush to the toilet, and the color of my stool seems lighter than before. It's also been quite loose. I've also been feeling bloated and gassy.
All right, any other symptoms you've noticed?
Yes, I've seen that the whites of my eyes and my skin have turned a bit yellowish. I've also been feeling itchy and more tired than usual. It's like I'm always feeling exhausted,
Do you feel pain anywhere? Any changes in your joint health, perhaps?
No, my joints are fine, but I do feel this dull ache around my stomach, kind of wrapping around to my back. It gets worse when I lie down, and it sometimes keeps me awake at night. I thought it was heartburn at first and took some antacids, but it didn't help much.
How has all this been affecting your day-to-day life, your work, for instance?
Well, I'm retired now. Spent most of my life working in a chemical plant as a chemical analyst. It was a stressful job, lots of responsibilities. Now, I just try to enjoy my retirement.
I see. Have you been smoking or drinking?
Well, I used to smoke a lot, around 20 a day. I quit when I retired, about 3 years back. I still have a few drinks over the weekend, though. Just some beers, nothing heavy.
It's good that you quit smoking. Was there a particular health concern that led to this decision?
Yes, actually. I had a hepatitis C infection, and then I was diagnosed with kidney stones about a year ago. After that, I thought it was best to quit smoking.
That must have been a tough time for you. Have you had any health concerns since then?
Well, a few months back, I had a blood clot in my leg, and I've been on anticoagulants since then. And just recently, they told me I have type 2 diabetes, which was really unexpected.
That's a lot to deal with, Mr. Thompson. What I'd like to do now is to arrange some tests for you to help us understand what's going on.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Looking at your recent audiogram, Mr. Smith, it appears that your hearing has improved somewhat.
Well, I'm not completely there, but I'm noticing sounds that I haven't been able to pick up before. It's still a bit difficult when there are lots of noises around, but it's much better when it's quiet. One thing I've noticed is that some sounds seem much louder than others.
That's very typical for the stage you're at. Although your hearing has improved to some extent, there can be unevenness in how well you hear different frequencies. Some will still seem louder than others, but we can adjust your hearing aid to help balance this out.
That sounds like a good idea. I'm just grateful to be hearing better.
Now look at question 26.
As we know, a large proportion of our diabetic patients have difficulty adhering to their insulin regimens, so we've been researching potential solutions. One significant finding was that the complexity of the regimen was a major barrier for many patients. While we can't necessarily simplify the regimen itself, we've found that providing patients with technology to assist in their diabetes management, like smartphone apps that remind them to take their insulin and monitor their glucose levels, has had a significant impact. Our trials show an impressive increase in adherence rates among patients who use these aids. This is a noteworthy development, considering that more traditional and often expensive methods have had limited success in improving patient outcomes.
Now look at question 27.
So you've mentioned experiencing irregular heartbeat. Is it causing discomfort?
It's not necessarily uncomfortable, but it is noticeable and it's sort of unsettling.
Does it make you feel anxious?
A little, yes. It's not something I'm used to.
Any issues with shortness of breath? I know you're taking regular blood pressure medication.
There have been instances, but I'm not sure if it's related. I have been feeling a bit lightheaded as well.
That sounds like it could be related.
I suppose so. It's a bit distressing.
Understandable. Let's run some tests to determine what might be causing these symptoms. Adjustments to your medication may also be necessary.
That sounds like a good idea.
Now look at question 28.
Good afternoon. How can I assist you today?
I've been having a lot of trouble sleeping recently. I think it's stress-related.
I see. Have you tried any sleep aids before?
I used to take some melatonin, but I don't want to depend on it because I'm already on medication for high blood pressure.
You're right in being cautious. Melatonin is generally safe, but it's best not to rely on it. Have you tried relaxation techniques or spoken to a doctor about your stress levels?
I tried meditation a few times, but it doesn't seem to help much.
It might be beneficial to talk to a healthcare professional about this. They could suggest therapies or medications that won't interfere with your blood pressure medication.
I think you're right. Thank you for the advice.
Now look at question 29.
So, are you ready to begin a new rehab routine for your knee post-surgery? This routine would involve daily exercises focused on strength and mobility.
That sounds quite intensive.
It would require dedication, yes, but the end result could be a faster recovery and a greater range of motion in your knee.
I'm willing to try anything if it helps with the pain and gets me back on my feet, but I do worry about whether I can stick to such a strict routine.
It's normal to have these concerns, but we'll be working together closely on this, and I'll be here to provide all the support you need.
Now look at question 30.
You asked about signs of chronic obstructive pulmonary disease in patients. What should I be attentive to?
Understanding the guidelines is essential, but remember, COPD can manifest differently in different patients. Chronic cough and difficulty in breathing are common signs, but a patient may also experience fatigue, chest tightness, and weight loss. COPD is often misdiagnosed, so if you suspect a patient might have it based on these symptoms, especially in the context of a smoking history, make sure to refer them for a pulmonary function test. It's also important to note that COPD is a progressive disease, and managing it effectively involves not just treating the symptoms, but also helping the patient make lifestyle changes like quitting smoking and getting regular exercise.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello, everyone. I am Dr. Maria Logan, a renowned neurologist. Today, I will share with you an equally important health concern, that is the growing impact of mental health disorders and the need for improved healthcare systems to address them. We are all aware of the increasing recognition of mental health as a critical component of overall health. Yet, how did we reach this juncture? In the decade leading up to 2010, we witnessed a staggering increase in reported mental health disorders, with global numbers rising by almost 20%. This increase, partly due to better diagnostic practices and partly due to actual increase in prevalence, is concerning. While recent narratives in media have begun to address mental health disorders with greater sensitivity, the stigma attached to these disorders still persists, leading to a vast number of individuals who remain undiagnosed and untreated. The healthcare systems, while evolving, are still not completely equipped to deal with the scale of this problem. There have been efforts to increase access to mental health care services, and these are making a difference. For instance, in the UK, the percentage of individuals receiving treatment for mental health disorders has increased by 15% over a 5-year period. While this is a promising trend, it is also true that there's much work to be done, as the increase in treatment rates hasn't been evenly spread across all sectors of society. Adding complexity to this situation is a recent research study which suggested that short-term therapy sessions can be as effective as longer traditional courses of therapy for some mental health disorders. While this research encourages a discussion around the effectiveness and duration of therapies, it also has the potential to send mixed messages about mental health treatment. It is important to remember that each person's mental health journey is unique, and what works for one individual might not work for another. Moreover, severe and chronic mental health disorders, such as schizophrenia and bipolar disorder, often require long-term and comprehensive treatment approaches. These conditions are analogous to drug-resistant infections in the realm of physical health. They require consistent and meticulous attention, and sometimes innovative approaches for effective treatment. A growing concern is the intersection of mental health and our increasingly digital lives. The pervasive use of social media and the digital transformation of our lifestyles can exacerbate feelings of isolation and depression, especially among the younger population. While technology provides an excellent platform for spreading awareness and resources for mental health, unchecked use can lead to exacerbation of mental health issues. But as with antibiotic resistance, the situation is not entirely bleak. Increasingly, healthcare providers are adopting a person-centered approach, tailored to individual needs and circumstances. New therapies, such as digital therapies and mindfulness-based approaches, are emerging and showing promising results. Just as the idea of bacteriophages is exciting in the field of microbiology, the advent of AI-based therapies and virtual reality techniques in the mental health field offer promising future avenues. While these new technologies are not without their challenges and limitations, they signify a potential paradigm shift in how we treat mental health disorders. So, as we continue to explore these emerging avenues and seek better ways to address mental health disorders, it is crucial to remember that early recognition and intervention, along with continuous and comprehensive treatment, are key. We need to focus on equipping our healthcare systems to deal with these challenges and ensure that mental health care is accessible and effective for all. Now, before I go on to
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, I'm Michael Evans. Today, I'd like to discuss a common mental health disorder affecting many people worldwide: depression. It's a complex condition characterized by persistent feelings of sadness, hopelessness, and a loss of interest or pleasure in activities. When I attended medical school, the understanding of depression was much different from what we know now. It was often described as a chemical imbalance, simply a matter of having too little serotonin, a neurotransmitter. While imbalances of serotonin and other neurotransmitters are indeed involved, we now understand that depression is far more complex, involving a variety of genetic, biological, environmental, and psychological factors. Let's address some misconceptions about depression. A prevalent myth is that depression is a sign of personal weakness, and that strong-willed individuals can just snap out of it. This couldn't be further from the truth. Depression is a real medical condition that requires attention and treatment. It isn't something someone chooses or can simply get over on command. Then there's the misconception that antidepressants always lead to dependency. While it's true that sudden discontinuation of these medications can cause withdrawal symptoms, they aren't addictive in the way substances like nicotine or opioids are. They don't create cravings, and patients don't need to increase the dose to get the same effect. However, it's essential to follow your doctor's advice when starting or stopping these medications. Let's move on to diagnosis. Depression isn't diagnosed with a simple laboratory test like a blood test or X-ray. Instead, diagnosis involves a thorough evaluation that takes into account symptoms, medical history, severity, duration, and the presence of other mental or physical health issues. We also have self-report questionnaires and structured clinical interviews, but these tools only aid in the diagnosis. The final call should be made by a qualified health professional. Finally, the question everyone wants an answer to: is there a cure for depression? Currently, there's no one-size-fits-all cure, but we have a range of effective treatments that can help most people with depression. Treatments often include psychotherapy, medications, or a combination of both. But every person is unique and may respond differently to different treatments. We're also exploring newer treatments, such as transcranial magnetic stimulation and ketamine infusions, which have shown promise in treating resistant forms of depression. People often ask about the role of diet in managing depression. While there's no specific diet to cure depression, certain dietary patterns may contribute to better mental health. For example, a Mediterranean-style diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats may have a protective effect against depression. The future of depression treatment is bright, with numerous innovations on the horizon, including precision psychiatry, where treatments are tailored to individuals based on their genetic makeup and other unique characteristics. But the first step towards recovery always involves reaching out and seeking help. Remember, it's okay not to be okay, and help is available.